You can't be back here. Step out of the hospital wing right now.
What? I work here.
I'm on duty. Look at my badge.
We got a report of someone wandering around restricted areas. That's you. Out now.
Wandering? I'm literally doing my rounds. Check the chart. Check the staff list. Ask any doctor here.
Don't argue with me. Step outside before this becomes...
Officer Brandon Mitchell had been with the Houston Police Department for 15 years. In those 15 years, he'd accumulated 31 formal complaints. 26 of them involved black women he'd accused of trespassing, loitering, or not belonging in professional settings: hospitals, medical centers, corporate offices, and healthcare facilities. A black nurse entering her shift was questioned for unauthorized access. A black nursing supervisor in her unit was detained for suspicious presence. A black nursing director in her office was told she didn't belong there. A black charge nurse during rounds was investigated for impersonating medical personnel. A black nurse practitioner in a clinic was handcuffed for trespassing in a medical facility. A black healthcare administrator in a meeting was arrested for being somewhere she shouldn't be. Every complaint ended the same way: hospitals confirming these were experienced healthcare professionals, internal review that cleared Mitchell, diversity training he attended but dismissed, written warnings that meant nothing, union protection that blocked discipline. One Wednesday evening in Houston, his 15-year pattern of assuming black women didn't belong in healthcare leadership positions finally confronted someone who dedicated her entire career to critical care nursing, who'd worked through the COVID-19 pandemic saving countless lives, who led one of the nation's top ICU teams, and whose arrest while caring for critically ill patients would spark outrage from the nursing community and expose a department that had ignored 31 complaints over 15 years. That confrontation would end Mitchell's career, cost the city $3.2 million, and expose systemic bias against black women in healthcare. Before we continue, where are you watching from? Hit that subscribe button. These stories expose the truth. Angela Thompson, a 44-year-old registered nurse and director of critical care nursing, was working her shift at Houston Methodist Hospital, checking on ICU patients and supervising her nursing team, when a police officer entered the unit and ordered her to leave. Her hospital ID badge was clipped to her scrubs. Her nursing credentials were displayed on the unit wall. Her name was on the staff board as the director on duty. No crime, no trespassing, no violation, just a nurse caring for critically ill patients. But Officer Mitchell saw her through a lens so warped by racial assumptions and gender bias that he couldn't process a black woman in scrubs as a nursing leader. Certainly not as someone who directed an entire critical care department, and definitely not as someone whose detention would endanger patient care. Houston, Texas. Houston Methodist Hospital, one of the nation's premier medical centers and a top-ranked hospital consistently recognized for excellence in patient care. The ICU was a state-of-the-art critical care unit treating the most severely ill patients. It was 8:15 p.m. on a Wednesday evening. The unit was busy with nurses monitoring ventilators, administering medications, and providing life-saving care. Angela Thompson had been a registered nurse for 22 years, the last 8 as director of critical care nursing at Houston Methodist, overseeing all ICU operations. She'd graduated from the University of Texas Health Science Center's nursing program, earned her BSN while working full-time in critical care, then her Master of Science in Nursing with a specialization in critical care leadership. She'd worked as a bedside ICU nurse for 10 years, became a charge nurse, then nurse manager before being promoted to director. She'd worked through the entire COVID-19 pandemic, leading her team through the darkest days when ICU beds were full and patients were dying daily. She'd held the hands of dying patients when families couldn't visit. She'd mentored hundreds of nurses. She'd implemented protocols that improved patient outcomes and reduced mortality rates. She supervised 120 nurses across multiple ICU units, managed a nursing budget exceeding $25 million, and reported directly to the chief nursing officer. She made $165,000 annually as director, compensation reflecting her expertise in leadership. She was respected throughout Houston's medical community as an exceptional nurse leader. That evening, Angela was working her usual shift, making rounds through the ICU units, checking on the sickest patients, supporting her nurses with complex cases, and ensuring quality care. She was wearing her scrubs with her hospital ID clearly displayed, moving between patient rooms, reviewing charts, adjusting care plans. She'd just finished helping a nurse with a particularly unstable patient when she heard aggressive footsteps and a hostile voice. Do you think officers should verify employment before confronting healthcare workers? Drop your answer below. Officer Brandon Mitchell had those 31 complaints over 15 years. 26 involved black women at professional facilities, particularly healthcare settings. Multiple supervisors had recommended his termination. Hospitals had complained about him harassing their nurses and staff. Houston Methodist had filed formal complaints about Mitchell specifically. Internal Affairs had flagged him as a severe liability at medical facilities, but the union blocked every disciplinary action, arguing Mitchell was protecting hospital security. His personnel file was thick with complaints from nurses, many with decades of experience, describing identical incidents of racial profiling and gender bias. One Internal Affairs report from 18 months ago stated, "Officer Mitchell demonstrates a persistent pattern of assuming black women in healthcare settings are not legitimate staff, particularly in leadership roles. His conduct has damaged relationships with major Houston hospitals. Recommend immediate termination as his presence at medical facilities creates patient safety concerns." The recommendation was blocked. Mitchell remained on patrol near hospitals because the system protected him. That evening, Mitchell responded to a call about suspicious activity. Someone reported seeing a black woman wandering the ICU. Mitchell arrived and saw Angela moving between patient rooms in her scrubs. "Ma'am, you need to leave this hospital immediately." Angela turned from a patient's room, startled. "Leave? I work here. I'm a nurse on duty." "I received a call that you're trespassing in this facility." Angela looked at her scrubs, her ID badge, bewildered. "Trespassing? This is my hospital. I'm the head nurse in the ICU. I'm director of critical care nursing." "That doesn't add up. Show me proof you work here." Angela pointed to her ID badge with her photo, name, and title clearly visible. "My badge is right here. Angela Thompson, RN, MSN, Director of Critical Care Nursing. I've worked here for 8 years. I run this entire ICU department." "That badge could be fake. I need official authorization." "Fake? Officer, I'm a nurse. I'm caring for critically ill patients. You can verify with hospital administration, with security, with the nursing office. You need to exit this unit right now." "Exit? I have patients on ventilators. I have nurses who need supervision. I'm responsible for patient care in this ICU." "Should nursing directors be arrested while caring for ICU patients? Let me know what you think." A bedside nurse who'd been working with Angela for years came over. "Officer, what's going on? That's Angela. She's our director. She runs the ICU." Mitchell barely acknowledged her. "Ma'am, step back. This is a police matter." The nurse, Sarah Martinez, was shocked. "Police matter? That's our boss. Angela has been our director for 8 years. What are you talking about?" Mitchell turned back to Angela. "Ma'am, final warning. Leave this hospital or you're under arrest." "Under arrest for what? Taking care of patients? I'm a nurse. I'm the director. I have critical patients depending on me." "You're trespassing in a medical facility and impersonating medical staff." "I am medical staff. I'm a registered nurse with 22 years of experience. I'm the director of critical care." Mitchell moved toward her. "Turn around and put your hands behind your back." "This is insane. I'm a nurse director. I have patients who are critically ill. Lives depend on the care we provide here." "You're under arrest for trespassing and impersonating a nurse." "I'm not impersonating anyone. I am a nurse. I'm the director of this ICU." Mitchell grabbed Angela's wrist. Angela didn't resist but spoke clearly. "I am not resisting. I'm complying. I am Angela Thompson, RN, MSN, Director of Critical Care Nursing at Houston Methodist Hospital. I've been a nurse for 22 years. I supervise 120 nurses. I'm being arrested in my own ICU while caring for critically ill patients. Officer Mitchell is arresting me for being a black woman in a leadership position. I have witnesses. This endangers patient care." Sarah was calling the chief nursing officer, hospital administration, and the nursing supervisor. Other nurses were gathering, staring in disbelief. Mitchell handcuffed Angela. Wrists that had started thousands of IVs, performed countless life-saving interventions, held the hands of dying patients, comforted families during the worst moments of their lives. He walked her through the ICU, past patient rooms where critically ill people depended on her leadership, past nurses who looked up to her, past the staff board showing her name as director. More staff emerged, horrified. "That's Angela," someone shouted. "That's our director." Nurses, respiratory therapists, physicians watched in shock as their nursing leader was arrested. Within minutes, Houston Methodist's chief nursing officer was at the police station. The hospital CEO was calling the mayor. The story broke. ICU nursing director arrested while caring for critical patients. The American Nurses Association was notified. Nursing organizations nationwide responded. Deputy Chief Rodriguez arrived, reviewed everything, spoke with hospital leadership, confirmed Angela's credentials and 22-year career, watched body camera showing her clearly in scrubs with her hospital ID in the ICU. She approached Angela, still handcuffed. "Ms. Thompson, this arrest was completely unjustified and endangers patient care. You're being released immediately with our profound apologies." She turned to Mitchell with fury. "You arrested the director of critical care nursing, a 22-year nurse, in her own ICU while she was caring for critically ill patients. Her staff told you she's the director. You endangered patient safety, badge, and weapon. You're terminated." Mitchell protested. "Deputy Chief, she couldn't provide immediate verification. She was wearing her hospital ID with her title clearly visible. She was caring for patients. You've generated 31 complaints. Houston Methodist complained about you specifically. You're done." The story exploded. Nursing organizations condemned it. Houston Methodist rallied behind Angela. Nurses nationwide expressed solidarity. Angela held a press conference in her scrubs. "I'm a nurse and director. I've dedicated 22 years to critical care. I was arrested while caring for ICU patients. 31 complaints, 26 involving black women in healthcare. The system protected Mitchell while he endangered patients." Angela filed a federal lawsuit. The allegations: unlawful arrest at her workplace, false imprisonment of a healthcare professional, racial profiling, gender-based discrimination, interference with patient care, deliberate indifference to Mitchell's pattern. Houston's attorneys found it indefensible. Body camera showed Angela clearly wearing her ID in her ICU. Her credentials were verified. Mitchell endangered patient care. The city settled. $3.2 million paid to Angela Thompson. Mitchell was terminated and faced charges. He pleaded guilty and received 30 months in prison. Angela testified before Congress. "I'm a nurse. I lead an ICU. I was arrested caring for critically ill patients. The $3.2 million reflects interference with life-saving care. Houston PD implemented reforms, mandatory verification at hospitals, termination at 2 complaints, healthcare liaison programs. Mitchell is in prison. The city paid $3.2 million. Ours." Angela continues as a respected director and advocate for protecting nurses from harassment. Comment if harassing nurses should carry enhanced penalties. And if these stories matter, hit that subscribe button. This isn't about one officer or one nurse. It's about systems that endangered lives by protecting an officer who harassed healthcare professionals for 15 years.